What if keeping your Social Security, SNAP, or Medicaid benefits meant proving you're working, or at least actively searching for work? How would that change your life? That is not a far-fetched question anymore. The Department of Labor's new workforce strategy puts a heavy emphasis on expanding work requirements, and that could affect millions of Americans who currently depend on assistance programs to survive. From food stamps to disability benefits, these new rules could reshape how people access and keep the help they need. Today, we're going to break down exactly what these new rules mean, who could be affected, and what the risks are if you or someone you love depends on SNAP, Medicaid, or Social Security. I want you to stick with me until the end because I'll share not just the concerns but also what policymakers claim are the possible benefits of stricter requirements. And I want to hear from you. Do you think work requirements are a good idea that promotes independence? Or do they just punish the people who are already struggling? Make sure to hit that like button, subscribe to Social Security Post, and share this video with others who need to understand these changes. When policymakers talk about work requirements, they're referring to rules that require people to prove they are working a set number of hours, participating in job training, or actively seeking employment in order to keep benefits. For SNAP, this has already existed for some groups known as able-bodied adults without dependents, but under the new workforce strategy, these requirements are being expanded. The Department of Labor has clearly stated that its goal is to reconnect as many Americans as possible with the labor force, and these rules are a big part of how they plan to do it. The reasoning behind these requirements is that people should not remain on assistance long-term if they are physically capable of working. Policymakers often frame this as giving people the dignity of work. But here's the flip side. Many individuals receiving SNAP, Medicaid, or even Social Security disability benefits face barriers like chronic health conditions, caregiving responsibilities, or a lack of access to affordable childcare. Asking them to prove work participation every month may sound simple on paper, but in reality, it can create more stress and hardship. So let me ask you, should benefits be tied to work, even if someone is already struggling with health, caregiving, or other serious obstacles? At first glance, the new work rules target what the government calls able-bodied adults without dependents. These are individuals between certain age groups, usually 18 to 54, who don't have children and aren't disabled. But if history has taught us anything, it's that once rules like this expand, they often spill over into other groups. Already, we are seeing discussions about how these requirements could indirectly affect low-income seniors who are just above retirement age, people with disabilities who don't have official documentation, and even caregivers who stay home to support children or sick family members. Veterans, parents, and medically vulnerable individuals are particularly at risk of being swept into stricter work requirements. Think about a single mother who is already working part-time but can't afford full-time childcare. Under these rules, she might lose benefits because her hours don't meet the minimum threshold, even though she is doing everything she can. Or consider someone with a chronic illness who isn't officially recognized as disabled but can only work limited hours. These are real-life examples of people who might be caught in the crossfire of policies meant to encourage work. Do you know someone who would be unfairly impacted by stricter work requirements? SNAP is one of the programs most directly affected by work requirements. For years, SNAP rules have included limits for able-bodied adults without dependents. They must either work or participate in job training for at least 20 hours a week or risk losing benefits after 3 months. Under the new workforce strategy, these requirements are being expanded to cover more people and enforce stricter reporting. That means if someone misses reporting their hours, loses a job suddenly, or doesn't find enough training opportunities, they could lose their food assistance almost immediately. Medicaid is another area where work requirements have been tested. A few states introduced these rules in recent years, and the results were troubling. Thousands of people lost coverage, not because they weren't working, but because they couldn't keep up with the paperwork or didn't understand the reporting system. In Arkansas, for example, when work requirements were introduced in 2018, over 18,000 people lost Medicaid coverage in just a few months. That shows how dangerous these rules can be when they don't account for real-life barriers. So let me ask you, do you think stricter reporting really prevents fraud, or does it just push more families into hunger and medical debt? Now, Social Security retirement itself isn't tied to work rules, Once you qualify by age and contributions, your benefits are yours. But the conversation changes when we talk about Social Security Disability Insurance, SSDI, and Supplemental Security Income, SSI. The Department of Labor's workforce strategy focuses heavily on transitioning people off public assistance, and that language raises alarms for many. There is a concern that individuals on disability benefits could face new pressure to demonstrate they are trying to return to work, even when their conditions make it difficult or impossible. This creates a very real risk for disabled individuals who already face long wait times and difficult approval processes just to get on benefits in the first place. Currently, over 8.8 million Americans receive SSDI, and more than 7 million receive SSI, many with conditions like severe mental illness, cancer, or advanced organ disease. Forcing these individuals to reprove their inability to work or participate in mandatory job training would be cruel and unnecessary. Should seniors and disabled individuals ever face work pressure to keep their benefits, or should their entitlements remain protected once they've already been proven eligible? The risks of expanding work requirements are clear. Vulnerable populations are the ones most likely to fall through the cracks. People with health issues may not meet the arbitrary thresholds of work hours. Caregivers may be penalized for staying home with loved ones, and seniors could be caught in policy changes that weren't meant for them. Even small paperwork errors can result in the loss of benefits. Remember, this isn't just about money, it's about access to food, medical care, and stability. The benefits cliff makes this even worse. That's when a person starts earning slightly more money but ends up losing far more in benefits than they gain in wages. For example, someone who gets a $1 raise could suddenly lose hundreds in SNAP or childcare assistance. This traps people in poverty because the system punishes progress. So let me ask you, do you believe work requirements solve poverty, or do they just create more obstacles for struggling families trying to get back on their feet? To be fair, some policymakers argue that work requirements do have benefits. They claim that requiring work or training encourages people to become more independent and reduces long-term reliance on government programs. For example, programs like apprenticeships and job training can help people gain skills that lead to better-paying jobs. In theory, this means fewer people would need SNAP or Medicaid in the long run. But here's the catch. Those positive outcomes only work if support services are in place. That means affordable childcare, reliable transportation, and accessible health care. Without these, work requirements often fail because people can't overcome the structural barriers holding them back. Imagine telling a single parent to work 20 hours a week without offering childcare. What happens then? Or asking someone in a rural area to attend training sessions without providing transportation. If work rules come with real support services, would you support them, or do you think benefits should never depend on work at all? So here's the bottom line. The government's new workforce strategy is leaning heavily on stricter work requirements, and that could have life-changing consequences for millions of people. SNAP, Medicaid, and even Social Security disability programs could be reshaped in ways that make it harder to keep benefits. For seniors, disabled individuals, caregivers, and low-income families, this isn't just about policy, it's about survival. Now I want to hear from you. Do you think expanding work requirements will actually reduce poverty and fraud, or will it just make life harder for those who can't meet them? Drop your answers in the comments below. I'll be reading and responding because your voices matter in this conversation. And before you go, please like this video, subscribe to Social Security Post, and share it with someone who needs to know what's happening. Staying informed is the first step in protecting ourselves and our communities.